Hello, everyone. It's Jen Freiheit from the Kenosha County Division of Health on Wednesday, June 17th. Today I come to you with some new data. Our numbers have been decreasing, but not to the extent that we want to see. Dare I say that we are stabilizing, although it is certainly not going away. We are seeing 9 to 20 new cases each day, an average of 13 to 15 a day. Our hospitalizations are decreasing, with currently only 10 hospitalizations for COVID, 3 of those of which are on ventilators. So please keep the most sick in your thoughts and prayers. Kenosha County is still classified as having a high burden. We're one of only 6 counties in Wisconsin classified that way. And we're one of 16 counties in Wisconsin that still have a high case status. There are 4 counties in Wisconsin that are still seeing a growing number of cases, but Kenosha County is not one of them at this time. We are also seeing that testing demand is slowing down, although testing is still a key strategic piece to public health controlling this pandemic. The Kroger Health site in front of Pick and Save will be done for good after this Saturday. They only had 387 collections last week. But our hospital and our Kenosha Community Health Center site at Gateway will continue for the long haul. There will be 2 new open community testing sites that will occur through the National Guard, one next week and one in mid-July as part of a staggered testing strategy. And as always, we'll advertise these via the Kenosha County COVID Hub website and our Kenosha County Health Facebook page and several other venues. There are 2 population health studies that will commence soon between the Wisconsin State Laboratory of Hygiene, the DNR, and the UW system, both Madison and Milwaukee, looking at communities that may be at risk for future outbreaks. So these include an antibody study, and one is also looking at wastewater spread. So I'm hoping to have some of these studies in Kenosha County and have requested such. I have asked the State Health Department for additional research briefs as the pandemic continues to change daily. Just 2 weeks ago, all but 12 states were either stable or on the decline, but now the country is back up to 22 states with increasing cases. So as we move into planning for the future of this pandemic, we must continue to learn as much as we can about how this virus continues to evolve and spread. And that is what our health department is definitely looking at. There is much planning going on into what the fall will look like, especially for our schools. We're looking at everything from securing personal protective equipment for school nurses and staff to looking at different models and scenarios for instruction, should that be a need. And our public health work has not slowed down in these efforts, so we will continue strong throughout the summer with planning. Our department did an assessment of how we handled the first 3 months of the pandemic, and as promised last week, I wanted to share the results with you. So first of all, looking at our strengths of our department regarding how we handled this pandemic, and by far and large, the health department staff recognized teamwork and flexibility. And I wanted to just read you a few of the quotes that some of the staff had said, because it really has been an amazing effort at teamwork, one that no consultant could be paid enough to teach an agency. So a positive out of this pandemic. One quote, "I have worked in public health since 1985 and have never seen this kind of teamwork before. Have never seen all local health department staff learn and work together like we have. It's been pretty amazing to be a part of." Another said, "It was great to see our health department come together and work as a team. We have never had support and guidance like this in the past." And a third one said, "This pandemic has shown what an amazing team the health department can be when we all come together. Everyone did an awesome job." And I could not agree more. You all have a very, very strong health department working tirelessly for you. The other strengths were knowledge of staff and the dedication to the community. The team was fast acting, adapting quickly, very dependable, extremely strong work ethic, and doing it all while working remotely. Some of the weaknesses of our agency, is, we always want to critically reflect, is that obviously there were the typical not enough staff, not enough time, spread thin, heavy workload, which all equated to everyone being very tired. Inability to reach certain populations is a key thing that weighs on us, and we're working on several quality improvement efforts for performance and process improvement, some of which we've already implemented just since taking this survey. So it's been quite the effort in continuous quality improvement, unlike I've ever seen in an agency before. We are seeing that evidence that our community is not taking this pandemic as seriously as if it's no longer a threat. People are willing to obviously take more risks. And we are seeing evidence of more people being less cooperative, telling us only what they think we want to hear when we're calling to try to educate them about isolation and quarantine. For example, we have not seen any evidence of increase resulting from the peaceful protests that occurred in Kenosha County, but this is not hard data. Certainly, we are seeing a reluctance of people willing to admit everyone with whom they've been in contact with, or whether they were at parties or gatherings. We have noticed some jurisdictions around the state that are seeing an increase in those aged 18 to 29, so we as well are keeping an eye on this. We had 159 positives for that age group in May and 63 so far for June. But this is certainly not everyone. Certainly there is a large part of our population that wants and needs us to keep them safe. They are following the guidance and keeping safe themselves, wearing masks when out in public, following all the rest of the guidance that you've heard over and over since the beginning. The businesses have been amazing, working with our teams to open as safely as possible. And I just wanted to give a shout out to CABA, the Kenosha Area Business Alliance, who printed window clings and signs, and they've made them available at various branches of the public library that businesses can take to post at their doorway to say, we are being as safe as possible, and we are a business that is concerned about the community and making sure we're doing everything we can to open our business safely. So we encourage all of you to take one of those window clings and signs and let the public know how safe you are being. One thing in the survey that we looked at was, what does our community need us to do that we haven't been doing very well? And one thing is certainly continued and better data, reaching out to our communities of greatest need. We're certainly looking for liaisons within these communities to help us reach our most vulnerable populations. The use of 211. 211 is new to Kenosha County, and so we maybe are not as good as we should be at keeping it updated, so that when our community dials 211, they get all the information that they need at their fingertips. But most certainly everything that really we need to improve upon is centered around health and equities. And so when we look at what is our new vision for our response to this pandemic, our new vision is to decrease the impact through harm reduction. Early on in this pandemic, our vision was to flatten the curve. And now we have a new game. So it's to decrease the impact through harm reduction. We have 4 new critical missions. It's too late to box in the virus at this point, so we must change with the climate and the culture of the pandemic and focus our efforts on protection and the most vulnerable among us, those at highest risk. Public health is well aware of what will exist if we do not do a good job in these next few months. So with that, our 4 new critical missions are education. Education was also a critical mission at the start of this pandemic, but for us, education at the time was, how do we educate the public about COVID and about precautions and measures they can take. And our education shift has focused to working with businesses and the community centered around health and equities and encouraging safe practices. You know, strengthening community health and social service structures has a direct effect on improving life expectancy and reducing incidence of chronic disease. So therefore, protecting the population that faces much risk from COVID-19, our racial crisis and this pandemic are not independent of each other. So really that education around our health and equities and how we can protect those most vulnerable. Second critical mission is around implementing improved data mapping and analysis systems for communicable disease tracking, surveillance, performance management, and reporting. This is all centered around our preparedness planning. Obviously, we are preparing for the worst, hoping for the best, but we're planning for in case there is a second or even a third wave, plus the future with large mass vaccination clinics when a COVID vaccine does become available. So a lot of preparedness planning is going on. Continued containment measures. Containment measures was our second critical mission at the start of this, and obviously we need to continue that. Testing and containment are 2 of our biggest tools in the toolbox to help contain this virus, and we will continue those containment measures, isolation, quarantine, social distancing. And really, the fourth critical mission is getting back to business, both internally to the health department and external within the community. For example, we hope to restore our public health services to 100% by October 1st, certainly sooner if we can. There is a desperate need in the community for us to get back to business. Our immunization rates are low. Certainly, there's still all other services that we need to get back on the docket, and our staff is eager to continue serving the public in that way. Our values, our top five values came out as communication, teamwork, dependability, transparency, and accountability, and certainly continuing those values that are very similar to what we talked about at the beginning of this pandemic. And with that, I just want to remind everybody with accountability, I want to remind that everyone continues to wear masks when out in public. It is a protective measure. It is not a farce. It is not fake. It is something that can truly help people when out in public. Continue washing your hands for 20 seconds or longer, remaining distance from others as much as possible. And of course, if you're feeling sick at all, please stay home and call your doctor or your provider. And if the community does not have a provider, there is the Kenosha Community Health Center. That's our federally qualified health center that can be a provider for you. So with that, I'm just going to check to see if we have any questions. And it looks like we have no new questions. So thank you everyone for joining us again. Next week will be the last one, unless of course we need to come back with any public message, but it'll be our last regular Wednesday night. And next week is when I'd really like to share some of the human side, some stories that have really guided the health department, lives that have been saved, and to really sort of bring the stories home about what public health is seeing without disclosing protected health information. But certainly we've gotten permission from some who have been sick to be able to share their stories. And so I'm looking forward to giving you better data next week. Hopefully we have some new metrics and to sharing the human side of the story. So thank you for joining us again. Stay safe when out there and let us know if you have any questions.